My name is Juby Phillip. I am a Senior Clinical Director of Operations at Harmony Biosciences. I am the lead for the LGS Phase 3 trial. We call it Lighthouse Trial. A quick introduction to Harmony Biosciences. Currently, we have 5 Phase 3 trials in neurology space, 2 in rare epilepsy, Lennox-Gastaut, and Dravet syndrome. A quick intro to Clemizole. It was an investigational therapy currently being studied for the treatment of seizures in LGS and DS. While Clemizole was originally developed many years ago as an antihistamine, Dr. Baraban from UCSF, using zebrafish model, discovered that it may affect brain pathways involved in seizures, leading to renewed interest in its potential as treatment for epilepsy. Oops, back one more. Okay, so zebrafish model. They are successfully predicts clinical efficacy. When he studied this in zebrafish, most standard of care anti-seizure medications were used therapeutically in LGS patients successfully identified in zebrafish Dravet syndrome model. EPX-100, Clemizole, suppressed spontaneous clinical and electrographic seizures in zebrafish. EPX-100 shows 5H2 receptor binding activity. And many other drugs that we talked about today that has a serotonin modulation is known to be important mechanism of action in treatment of Dravet syndrome and Lennox-Gastaut syndrome and other DEEs. Our phase 1, the EPX-100, was safe and well tolerated. And this is our ARGUS study, which is the Dravet study that's currently ongoing. We had some preliminary data, there you go, that shows the open label effectiveness that showed that the participants who had at least 6 months of exposure to EPX-100 had an approximately 50% median reduction in countable major motor seizures compared to baseline. Further, greater than 90% seizure reduction was observed in the 15% of these participants. Again, these are open label extension data. All right, so talking about our current LGS trial, phase 3 global trial, I just want to say thank you to Tracy and her partnership. When our protocol was first written, we sent it to Tracy and her team to look at it because clearly we want to make sure we are working in a model that's catering to the patients and their family. Specifically, even our seizure diary was tested by Tracy to make sure it's friendly. I know seizure diaries can be very difficult for families to enter seizures every day, so thank you. This is our country footprint. We're recruiting 260 patients across 15 countries. That is North America, Latin America, Asia, and Europe. Our primary endpoint is percentage change in major accountable seizures from the baseline period through the end of the double-blind period. Our key eligibility criteria, we're looking for ages 2 to 55, seizures not completely controlled by ASMs, history of EEG consistent of LGS, and then onset of seizures at 11 years of age or younger, and then 4 countable major motor seizures during that 4 week of screening or baseline period in a stable regimen of ASMs. This is our trial design, which is a very standard design screening. As we mentioned, 4 weeks of double-blind period with 12 weeks of maintenance into open label extension of 52 weeks. As you can see, I think Helen mentioned about patients traveling to sites, and we can see that how difficult that can be with your loved ones. So we have a complete virtual option, which is at our home option that I do want to talk about briefly. You will be able to participate in this trial virtually at the comfort of your home. So this is a completely, all visits will be done at home. Nurses will come to your home wherever you are. And this is currently being offered to all of our US patients. As you can see, our booth is next door, and we have Science 37, who's our at-home option agency that will come. And again, thanks to Jennifer, who trained all of our nurses on how to manage LGS families and patients, what they should expect when they come to your homes. So again, a great partnership with the LGS Foundation. All right, and these are our physical U.S. trial site locations. Again, we have active sites all across the U.S. If you would like more information on this trial, please reach out to us at the lighthouselgsstudy.com, or you can visit us at the booth. Again, thank you for your participation, and some families have already participated in our trial. So we are so grateful for all of you and your participation. Again, if you have any questions, please come us and visit us at the booth. Thank you for your time.